All right, welcome everyone to the Michigan HIV AIDS Council Community Engagement event. How can I protect myself against COVID-19? My name is Alexis Hunter, and I serve as one of the co-leads for the Community Engagement Committee, along with Ari Hampton. For more than a year, we have all faced the challenges that surround COVID-19. There's a lot of information out there about COVID-19 and the COVID-19 vaccines. We are facing the unique challenge of navigating the HIV/AIDS and COVID-19 epidemics. With the emergence of COVID-19, people living with HIV may face another health burden and be at heightened risk for serious health issues associated with COVID-19. This can affect the well-being of persons living with HIV and possibly interfere with healthcare and access to HIV treatment. What we want to achieve today is a non-biased conversation about tackling stigma and discrimination that surround COVID-19 and COVID-19 vaccines. So before we begin our panel discussion, we're going to take a moment of silence for people that we've lost due to the current epidemic and the HIV epidemic. All right, thank you everyone for that. So as an overview of our discussion today, we're going to begin with the introduction of our distinguished panelists. Next, we're going to present some statistics about COVID-19 and COVID-19 vaccinations for the state of Michigan. And finally, we have a set of questions from the community that the panel will discuss. If there are any other questions, they could be added to the chat feature. And right now, I'm going to go ahead and start with Leon introducing himself.
All right, good afternoon, everyone. I am Leon Golson, Director of Prevention Programs for Unified HIV Health and Beyond. I've been in that position for 13 years now, and I have been living with HIV for a little over 30 some odd years now, and been conducting HIV prevention work in the state of Michigan for about the same amount of time. So I'm happy to be with you all today, and hopefully I'll share some useful information for all of our viewers and listeners.
Thank you, Leon. And David, please.
Hi, my name is David Ponsart. I supervise the infectious disease programs at Access Community Health and Research Center. Like Leon, I've been involved in HIV for over 25 years, prevention and care. And more recently, since the COVID pandemic started, we've been doing community-based COVID testing and more recently, administration of COVID vaccines in our clinics.
And Ari, please.
Hey everybody, my name is Ari Hampton. I work for the Detroit Public Health STD Clinic here in Detroit, Michigan. I've also, I'm a prevention specialist, and I also work as an HIV activist internationally as well. I've been a person living with HIV going on 11 years now, a little bit over. So I've been a young person living with it. And so today, my hope is just kind of giving a little bit of insight around stigma and discrimination that surrounds both the epidemic of COVID and HIV, and also just kind of telling my experience of being a person living with HIV and also receiving the vaccine and being fully vaccinated.
All right, thank you, Ari. So what we're gonna do is just go straight into some statistics that Ari has prepared for us. So we're gonna go ahead and cue that up.
All righty, everybody. So our first stat that we have is just some cases that we've seen. And you can see that these cases were collected around April 24th, 2021. These numbers have been updated a little bit, and we will release that site where you can get this information inside of the chat before the end of today's session as well. So you see here that majority of our hotspots, as we see the cases, are surrounded in the Detroit, Wayne County area, and some in Livingston as well, and Macomb. And so those are pretty much where we've been seeing the biggest trends of the COVID cases since the beginning. Next slide, please. And so you can kind of see the continuum of when we first started in the epidemic until the last of last year. And you can see where the high spikes are, where people were reported being testing positive for COVID. Next slide. And you can kind of see the continuation into this year and how the high spikes are around the April area. And so even though we started in towards like February, March area where vaccinations were being pushed out, we still seeing high cases and high rates of people still testing positive for COVID. Next slide. And so, and like I said before, these were captured around April 24th, 2021. So the cases have been increased a little bit. And so those numbers may shift just a little bit. Now, here we are in May, towards the end of it. So total confirmed cases, you see 819,320. Total deaths, 17,289. Daily confirmed cases, 4,698, with the average of daily COVID-19 average deaths of 121 persons. And so you can see the real extreme emphasis on why we're trying to push out more information about where you can get tested, where you can get vaccinated, things of that nature. Next slide. And this is just kind of going back over, the vaccination coverage. And so residents vaccinated, you see the number there, about 33.7% of the residents have been vaccinated and with the Michigan population of the number here. Next slide, please. And then this is just capturing the beginning of this year up until about April 24th, 2021. And you can see about 37.2 people were vaccinated of the Michigan population. And so we wanted to see those rates increase. That way we can see more individuals having that protection from COVID-19. And then the last one is just some more statistics coverage broken down by doses completed by ethnicity, coverage by race through the state level, and then coverage also by age group and coverage by sex. And then you can kind of see that, especially around the gender, a higher percentage of initiation or the completion is in the female population, where males are slightly a little bit less. And then when you go into the age gaps, you see people from 65 to 75 plus are a little bit more inclined to be vaccinated due to, this is really around the coverage period and who were in different categories of first signing up to go ahead and get vaccinated. And so these numbers are going to be shifting due to more people getting vaccinated, restrictions, taken off and stuff like that. All right.
Thank you, Ari. So before we get into our questions from the community, I want to ask our panelists if anyone had any comments or statements in regards to the statistics that we just saw.
I'll just say that it's reflective of our work with HIV and the treatment cascade connected with HIV and trying to, assist community members who are living with HIV to start treatment and stay on treatment. The both are mirroring the fact that there's lots of work yet to be done. And I think we can do it.
I wanted to say it was a little bit disappointing to me in looking at those numbers to see, you know, the small fraction of African Americans being vaccinated and a huge portion of white folks being vaccinated, when COVID, as we know, has been disproportionately impacting communities of color. So I really, really, really want to encourage all the people of color who are listening or will be listening, please take the vaccine.
All right, so we're going to go ahead and move into our questions from the community. And panelists, feel free to answer one at a time. We will begin with Leon for the first question, okay? So what are some barriers that you can think of that keep people from being tested and vaccinated?
Particularly for African American community that David spoke to so well, a lot of history goes into the resistance to embrace vaccinations. Unfortunately, there's been a lot of damage done throughout history with regards to the testing of vaccines. And unfortunately, people of color, particularly African Americans, suffered the brunt of that. And that echoed throughout the decades and is still very much present here in the mindset. I think about some of that as well. And I am vaccinated. What got me to work through that history, that's a part of the reason why some folks aren't, really embracing it, is just looking at those vaccinations that did work and that were successful, are successful. So I thought about the polio vaccinations, measles, mumps. When done right, when they work, they really work, particularly if they're done right. Again, access to healthcare, transportation are some other barriers, competing priorities. If I don't have a place to stay, getting a COVID vaccine probably won't be high on my list of priorities. If I don't have food to eat, getting a COVID vaccine probably won't be high on my priorities, particularly if I've got a family with more than just myself to try and take care of. So that's just a little tip of the iceberg of some of the barriers that's preventing us from really getting those figures, those stats to look better.
Yeah, I definitely want to just kind of piggyback off of Leon. I think he hit the nail right on the head with everything. I think when you really look at it, especially for us who've worked in public health for quite a long time, I'm the baby of the group on the panel, but it's still the same as it was back in the early 2000s, that like it is right now, even back in the 90s, where stigma and discrimination is still prevalent and still heavy. And you can kind of see the similarities when we're doing the work, trying to educate people about HIV, and the correlation that we're seeing with the stigma and discrimination surrounding COVID right now, and how people are afraid of it. Is there an active strand in the vaccine that I'm getting? Is it going to make me sick? The side effects, all these things that we have to educate people on when it comes to treatment and prevention when it comes to HIV. Now we're having to do the same thing with COVID, and you can kind of see the correlation between the two.
You want to add anything, David?
Vaccine hesitancy, I mean, this is something that we have struggled with in administering vaccines, people who are hesitant to take it. This is something I've even dealt with within my own family and my friends circle. Either people saying the technology of the mRNA vaccine is too new, I don't trust it, how did they get the vaccine out so fast? There was a lot of questions, and I don't have a lot of answers. Actually, most of us don't have a lot of answers. We definitely don't know about long-term with regards to vaccines, but I signed up for the Moderna trial in September of 2020 because I wanted to be part of the change. I wanted life to go back to normal. And for me, it's worth the risk to get our lives back and to make sure, more importantly, that we don't lose our lives in the process.
Yeah, I definitely think you hit the nail on the head with that one, David. Like I received both of my vaccinations too earlier this year around February. And I think I had some hesitation before I even took it myself, just because I've been on the front line still working in the community since the beginning of all of this. You know, people aren't stopping having sex. So we still had to keep on seeing everyone. But my hesitation as a person living with HIV, there wasn't so much information that was out there for what it would do to someone living with HIV. You know what I'm saying? That our health is so important to us. Our immune system is so important. And so I didn't have the proper information, but I knew not only for the people I work around and for myself, but I wanted to get the vaccine. One of my biggest reasons of getting it was due to my family. You know, having people that are older, that had compromised immune systems as well, that were more susceptible to going into the hospital and possibly not making out. You know, so that was my biggest push of getting it. But it was scary, you know, even just contemplating it to getting it. And you know, I'll talk a little bit more about my experiences. I don't want to take all the time, but yeah, it was definitely scary. But I'm glad I did it. You know, just so I can have a peace of mind, not only for myself but for my family as well.
And I'll just add to that, just echoing Ari, particularly about the piece about compromised immune systems. As a person living with HIV, I don't want to have to overtax my immune system, but having to deal with something else. It's already getting a good workout with dealing with HIV. So it made sense to me to cut my immune system a little slack, go ahead and get the vaccine. So that's one less thing it has to deal with. And when at the end of the day, with regards to whether or not this vaccine is you know, was rolled out too fast, or with all of the questions, and it's better than sitting on our hands and doing nothing. Because that's the alternative. That's the other thing. That's the other choice. You either take the vaccine or you do nothing. So.
And, you know, I think that it's important for the community to understand that we're all walking through this together. We all don't know the side effects of long term. We don't know. So we're all learning that together. So it's important to have events like this where we can share those resources, where we can share our experiences, where we can share those things that we do know and get a better understanding of those things that we don't, but together, you know? So, and as somebody that has also been fully vaccinated as well, I can speak to some of the things that you all have said, and really being able to understand why I was doing this for myself. And I want folks to know that everybody has autonomy to make this decision for themselves. We're just trying to give information that we know about what we've experienced so that people can make their own informed decision. So our next question is, what are some of the most common side effects people have when receiving the vaccination? So we'll start with Ari this time.
So majority of so I'll start with like the general one. So most people that I've talked to who've had the vaccination just experience like tiredness a little bit. You know, it could be a sore arm, a little fatigue. Usually that tends to dissipate within the next couple of days. I haven't heard of too many serious side effects from most folks. Really depends, it's individual. I always tell people with anything that you're putting into your body, whether it's medications, vaccinations, whatever, it might be a little slightly different for you, just because we're all unique in the way that our body is made up and how we intake things. And so it's going to be different for folks. One of the side effects that I did have when I got my first shot was I ended up getting pneumonia. And that was the first time that I've ever had anything serious happen as a person living with HIV. And I've been living with it for 11 years. So that was my first time that I ended up having to go into the hospital for something serious. And I was really confused because, like I said before, my apprehension as a person living with HIV was, what is this going to do to my immune system? And there was no real answers. And so they couldn't really tell me if I got pneumonia from the vaccine or if pneumonia came from something else. So that was an interesting time that I didn't want to talk about it too much because I was so out about getting the vaccination up front, and everybody was like, oh, you know, I'm apprehensive, or it's really cool. You know, as a leader working in the field of HIV, we try to strive to kind of be the forefront of what healthcare systems look like and services. And so typically we have to take the first step. And so I don't want to shy people away because that was my experience. But at the same time, there was no information for me to say, is it okay to get the second one? And I had nurses when I was at the ER tell me not to do the second shot. I had people tell me it's going to be okay. So there was no real information for me, and it was a scary time, but I decided to go through the second shot, which I had no side effects with the second one, which was really nice. and I'm thankful for that. But yeah, and you know, it's just experiences like that I don't think we get the authentic conversations that we're having like we are today for the populations that need it. Because, you know, maybe I'm not the only person that experienced that. And, you know, we needed to share those stories so we can have a better understanding of what's really happening.
I know one person who is also living with HIV who said after they got the shot, they felt energized. They hadn't felt that good in years. So, and that's rare that I've heard that, but that was that person's experience.
For me, I was being closely monitored, and it was a little nerve-wracking, to be honest, not knowing because it was a double-blind study. So I didn't know initially if I had gotten the vaccine or if I had gotten a placebo. And as it turns out, I did get the placebo. So my first shot of the real vaccine was in January, and my experience was a sore arm, and that was it. They had told me after the second dose that there was potential to have more side effects, which I didn't experience any. One of the other things that they told us in the was that if you had previously had COVID, that you may experience more side effects after you get your second dose of vaccine than if you have not had COVID and get your second dose. And since I had never had it, that's why I was eligible for the trial. And then also maybe why I didn't experience any side effects really, except for the sore arm.
All right, and I think it's good for people to know that there's been varied experiences with the side effects. You know, some people have nothing, some people have a lot more, you know. My personal experience, I didn't have any side effects with the first dose, and the second dose, I felt like I had the flu, you know, but as soon as it came, it went, you know. I kind of had those flu symptoms, and then maybe a day and a half, I was kind of having the body aches and the fever and the chill, but then as soon as it came in, it was gone. And then I was, you know, I was back to myself, you know. And it's just important to also note that that doesn't necessarily mean that something was wrong with the vaccine. It actually more or less means it's your body working to figure out what is this that just came into my body. And then once your body figures out, oh, wait, that was something good, then you're back to normal. So, all right. So this question goes out to everybody. Now that you've been vaccinated, can you return to the world without any restrictions?
Well, I was pleasantly surprised that when I went for one of my skating lessons, the rink I go to, is no longer taking temps. And if you're fully vaccinated, as I am, you do not have to wear your mask in their facility. So yes, David, yes. So I was so happy and relieved to see that. And because it's kind of tough. I don't care what they say. It's tough breathing through those masks if you're exerting yourself physically. I know early on someone had did this 1,000-mile run in a mask and they were like, oh, everything was fine. I'm like, mm-hmm. So I was so happy to be able to skate without that mask on. That being said, I still wear my mask in those venues, those places that have the sign posted that I should wear a mask before coming in. So I think slowly but surely, and I'm hopeful that we can definitely increase our numbers of individuals getting vaccinated. We're going to be seeing more of that happening. I can relax now more when I'm hanging out with my friends and family, because I know, I've got myself covered on that end. I know it doesn't mean I can't get the virus, but there is some peace of mind for me in knowing that if I do get exposed to it, hopefully I won't get a very complicated version of it that will, land me in the hospital or anything like that.
Yeah, I still wear my mask. Even though I'm vaccinated, because I work in a clinic and it's a closed environment, talking with my doctor and the protocols that we have put in place, even though everyone is fully vaccinated at the job that I work at, because we're still working with all types of populations in the community, it's just better for us to go ahead and continue following the protocol of wearing our masks when we're around other individuals inside of the clinic, because we still don't know at this moment. It's still something we're still gaining more knowledge about than everything else. And, my mother ended up getting sick around the time. She ended up getting vaccinated, but she ended up getting COPD. And so for just reasons for my own, I just like to protect myself because I know I'm around her a lot. And I just don't want to take any chances. I do feel like there's a little bit of a relief that's there when I am in spaces, when I've been out at the nightclubs. As long as we're out in the open space, I don't mind taking off my mask a little bit. But when I go around crowds and stuff like that, I'm putting it back on just because I don't know. I'm such a stickler at this point about the mask thing that I don't like it, but I know it's useful for us to protect all of us as much as possible. So I still just try to follow protocol as much as possible.
Yeah, I just wanted to echo what Ari was saying. We're still wearing our masks in the clinic. We're seeing patients and requiring people that come in to wear masks, but there is a sense of relief, at least that I had once that 2 weeks went by. And it reminds me of this whole experience is reminding me a lot of where we're at or where we've been, I should say, with HIV. A new virus came around. We kind of knew how it was spread, but we weren't 100% sure. You never know if the next guy you hook up with from Grindr is going to be a death sentence for you. Obviously we didn't have Grindr back then, but I think you understand my point. And then with the vaccine rollout coming around, the reception is kind of similar to what we had when PrEP came about, and we found out that there was a biomedical prevention method that could keep us from getting infected with HIV. This COVID vaccine can keep us out of the hospital. And so it's almost like watching the HIV epidemic unfold again, but in fast forward for the digital age.
Absolutely, David.
So for this next question, I'm going to begin with David because you kind of brought it up a little bit earlier. So what will it take to help move people forward, especially African Americans, in taking the vaccine?
Well, the distrust in the system and the distrust in healthcare and government that is experienced, the generational trauma that the African American community has is wholly justified. And I can't really speak to what it's going to take to move that needle. because that's not my experience, but I think understanding better where we're coming from, where the vaccine comes from, the mRNA, how that technology works. You know, one of the things that's different about the Moderna and the Pfizer vaccines is that they're mRNA, which is messenger RNA. It uses a benign virus as a carrier to carry the messenger RNA into your body, which then induces some of your cells to produce the spike protein that is on the coronavirus itself. You may have seen the pictures of the little red spikes that surround the circle of the virus. And so in doing so, your body recognizes that spike protein and produces antibodies against the virus that protects you if you get infected with the actual virus. But unlike other vaccines that use a weakened or dead form of the virus, there is no COVID in either the Pfizer or the Moderna vaccine. And the mRNA technology, and they said, you know, this is new. It's the first time we've ever used mRNA for a vaccine, but the mRNA technology is over 10 years old. The technology itself is not new. The application of using it for a vaccine is new, and it opens a whole host of possibilities across the spectrum for medicine and even for HIV treatment. If we can reprogram the way our body responds. So this should be so exciting for everybody, not scary. I understand things you don't understand, things you don't know are scary, but this is a very, very exciting time, not only because we get away from, you know, social distancing and masks, but also thinking forward about what we might be able to do with this technology in the future.
Yeah, I think David really expanded that beautifully. I think one of the things that I will just kind of touch on is representation and transparency are things that we all need, you know, for any population, any community. If you don't see anyone like you that is experiencing or educating or anything of that nature, there's going to be a distrust that's there. Solely because of the generational traumas that's happened in healthcare services, especially for the African American community. And so we need to be as transparent as possible. I think understanding what it's doing for you, you know, as somebody living with HIV, I think as a young person, when I acquired HIV, not infected, acquired. But I think I was so scared because I had no clue what HIV was. I didn't understand what it was doing to my body. And it took for somebody to come down and really break it down to me in a sense that I could possibly understand what it was doing, how it got in me, and what the medicine could do to prevent it from spreading even further than what it was, to compromise my immune system even more. And so if we attack the stigma and discrimination around COVID in that same sense that we do with HIV, I think a lot more people will have the trust that's building there to acquire more vaccinated individuals, instead of thinking that a herd immunity is something that's going to protect us all, because that's not. Okay. So.
And I'll just add on, it would help to make sure that as far as testing for COVID, it's not painful. I think are trying to get away from shoving that thing up into folks' brains. That would be a big help to get rid of that. Free transportation to vaccine sites would be great. Offering the vaccines at all homeless shelters, any type of food fair or food pantry, trying to bring the vaccine to where the people are would be some ways to kind of, you know, make it more accessible.
So really, education and accessibility are going to be key ways to get the community, and with emphasis on the African American community, to really uptake in what's going on with vaccination efforts. And, you know, we know syphilis, the syphilis study, Tuskegee study, not a secret. Sterilization of Black women, not a secret. You know, these are things that we do know. However, we're also aware of, as Leon spoke about earlier, the impact that vaccinations have had on human society. You know, the decrease in polio, the decrease in mumps, measles, you know, and the own strides that we've made within the HIV AIDS community as far as medications, you know, how that's been able to help folks with keeping their counts down and all of those things. So it's just a matter of letting people know and being transparent, as Ari said, to what's really going on, what's happening in your body, you know, and having more places where we can provide those resources, webinars where we can talk about things like that could be the most useful for folks. So,
I wanted to point something out too about, I'm sorry, I've got like some kind of gnat in my face, but if you look at those stats that Ari put up earlier, if this was a real bad thing, I mean, speaking to the motivating the African-American community to get vaccinated, if this was some kind of an experiment or some kind of thing, you wouldn't see that huge number of white participants getting the vaccine. I think maybe take solace in that, or take a cue that it's not as bad as maybe it could be, or I'm not sure what the right answer for that is.
but I think that also is just trust in general. So, you know, we can see thousands of white people getting the same vaccine and still think that I'm getting something different. So it's going to be the trust itself. So, and building that trust is going to come from education. Go ahead, Ari.
I was just echoing what you're saying, Alexis, is, you know, it's the distrust that's there. I will say it's also a thing of access, like Leon was talking about, and how even when you're looking at insurance companies and who's covered, and you know, how we're treating healthcare services as a whole, there's better services that are in the suburban sites than it is in the urban population. And so we know that the hardest hit populations are usually in the urban settings, African-American communities, LGBT populations, homeless populations. But the better services are still geared towards white people as a whole, or people who are better off social economic wise. And so these are things that we need to start. It's one thing for us to do the work that we're doing. We're fighting a huge wave when we don't have the powers that be, insurance companies, agencies that have the money, who are federally funded, that we're not calling them on their BS. Because if we're not having checks and balances put in place, we're just going to continue on with this hierarchy of services that really does no justice for anyone. Because even though white people are getting better services, they're still getting infected, you know, and we have to look at the trend as a whole. We all are human beings, and access equally across the board for healthcare services should be mandated.
All right, thank you, Ari. Anybody want to add anything more? Leon, David want to say something else? Just want to make sure.
I just would like to say that hopefully we can ride the momentum of calling BS out, as Ari put it, with regards to the fact that how the election turned out, the pushback with storming of the Capitol. If we can ride that momentum and direct it towards, you know, trying to get some equality with regards to healthcare and insurance and services, I think we'll find ourselves in a better space. It looks like this is the time for something like that to happen. Feels like this is the time for something like that to happen.
Going back to representation matters, having people that are fighting for you in your communities, getting out in the vote, you know, that's it. It's all important for the cycle of progression.
And, you know, we'd be remiss if we didn't mention how the socio-political climate has affected the way that this entire COVID-19 testing, COVID-19 vaccinations, COVID-19 information has been disseminated. So again, education and accessibility to the education and the actual vaccines is going to be key to us moving forward. So this next question is, will there be more walk-in, no appointment necessary venues to get the vaccine? So do any of you know of any resources, any places where you can just walk in and go ahead and get the vaccine?
I want to say in my area where I live, there are a couple of chain drugstores, CVS's, Rite Aids, that allow you to just come in and get a vaccine. Yeah. But there's still too many appointment only situations, and it would be great to just get rid of those. Mhm.
Yeah, I know when Access has been doing our vaccine clinics, they have always been walk-in, and they're not doing it anymore. But I know Ford Field was also doing walk-in. It depends on the location, really, but our experience has been that the walk-in only clinics have a better response, and people are more willing to take the vaccine if they can show up when it's convenient for them, even if it's like the last minute, like, let me go get my vaccine, I've got a couple hours.
Yeah, I know, like Leon was saying before, CVS Pharmacy does have the component of a walk-in. And I know you also have to do several of them, like Rite Aid and other pharmacy stores. You do have to make appointments. But I will say, if you want a good resource of where you can find a vaccine site near you, you should go to www.michigan.gov/COVID-vaccine. And you can find some really great resources there as well.
All right, thank you very much, Ari.
To speak to part of the reason why a lot of places are requiring appointments, because of the way that the vaccines are packaged. For example, the Pfizer vaccine comes 6 doses in a vial and has to be reconstituted. And the Moderna vaccine comes in 10 doses in a vial. And so with the scarcity, originally actually is becoming less now, but with the scarcity of vaccine, a lot of sites wanted to make sure that no doses went to waste, that nothing got thrown away, that we got every shot in as many arms as possible. So that helps with that. And we did have some trouble with the walk-ins where, you know, we had to let people wait until either 6 people showed up so we could open a new vial, or 10 people showed up.
And that was something I had no idea about. Wow. Okay. And that makes a lot more sense to me. And I think that's something that the community definitely needs to hear. You know, when it's not that we're trying to limit, or anyone is trying to limit the amount of vaccines, but there are certain circumstances where things could happen with the vaccine itself. And we're just trying to make sure that everybody is able to get them in the time frame that they need to be used. So, all right.
6 hours after it's drawn up is the limit.
Okay. All right, anyone else want to add anything else? Or can we move on to the next question? Okay. So how soon will we need booster shots for the vaccine?
I think I've heard 6 months. Go ahead, David.
I've asked that same question when I had my appointments for the trial, because they're following me for 25 months. So I have had quite a few opportunities to ask about the variants. Are we going to get a booster that covers the variants? Are you going to change it? Are we going to get a third shot? And the answer that I always get is, we don't know yet.
Yeah, I think that's pretty much the consensus right now is we're still trying to figure it all out. And I think more news is going to come down the pipeline later on, but as of right now, it's not too much is known.
Yeah, pretty much as we said earlier, a lot of stuff we're all figuring this out together in real time. So that's going to be information that's going to be coming down the pipeline. I did hear, as what Leon was saying before, maybe after 6 months, but that hasn't been confirmed just yet. So we're kind of waiting on that answer, just like the rest of us, you know. So this is our final question, and I'm going to direct this first to Ari. So what are the similarities of stigma between COVID-19 and HIV?
Yeah, so a lot of the stigma that's surrounding it is, people feeling like, you're dirty or you're a virus or you're infected. Those stigmatizing words that make you feel less than the human being that you are. And understanding that we all go through things health-wise that are always going to compromise our immune system, whether that's the flu, whatever that may be. But breaking that stigma down and understanding that just because you tested positive for COVID or you've had it before, it doesn't mean like you are an infectious person. No, you're a human being that got sick. You're trying to get better and you're trying to make sure that you're not anybody else is acquiring it. Is the key information that we want people to walk away with. Not feeling like you should, segregate yourself from society or something of that nature, because that's not the case. You have to educate yourself when it comes to health in general. Look at what we have to do for HIV and how most folks are still having that stigma that surrounds them that we've been seeing since the 90s, the 80s, thinking that it's solely only gay men getting it, or only African American populations are going through this issue or something of that nature, and that's not the case. And then we see the xenophobia that's happening when it comes to our Asian population and how the previous administration wanted to single out a whole community and making it about them when it wasn't. This is just health. Things happen in the grander scheme of populations. And so it's our job as healthcare workers to dismantle and, push out that stigma and that discrimination that majority of the communities that are facing can feel liberated from.
What's been interesting for me is the stigma around wearing a mask. Wearing a condom helps prevent the spread of HIV, and wearing a mask helps prevent the spread of COVID. But we've never experienced the kind of stigma around condom usage that we do around wearing a mask, where there's times and places where if you go into a public space wearing a mask, that you feel like you're the outsider, or that you're going to be either intimidated by others, or even possibly accosted or attacked or whatever. It's crazy. I don't understand it.
I agree, David. I think some of that might have to do that, the condom wearing of a condom is something that takes place in the confines of our intimate spaces. It's not in everyone's face necessarily, whereas wearing a mask is. So, and I guess my response to your question, Alexis, is I would like us to be very careful that we don't get into that I'm better than you or I'm greater than thou that we went through and still going through to some extent as it relates to HIV. For people who don't have HIV, I know there was a period where it was an issue. It was concern because people were, carrying themselves as if they walked on water because they didn't have the virus in their body, and treating people and making them, those of us with HIV, feel less than. So I would just like to make sure that we're careful not to fall into that same mindset with regards to COVID. Folks of us who are vaccinated versus those who aren't vaccinated, the mask wearing as well, doesn't make us any better than the other person standing next to us. I want to make sure that we're mindful of that at all times.
I love that, Leon. Yeah, I think it's having empathy, and especially now that more people are becoming vaccinated, and in Michigan, June 1st, a lot of the restrictions are being lifted. I think like David said, going into a space and being the only person with a mask, now reverse that around and everyone has masks on that are in a space, and you have a person that may come in that feel like I'm vaccinated and I don't need to wear one, not singling them out either. We need to have the empathy, just like when I'm counseling someone and they're saying, well, I messed up because I didn't use a condom. I'm not going to berate you because you didn't use a condom. That's not the point of counseling. That's not the point of you obtaining services. The point is understanding that life has risk in it in anything that we do. And you just need to know the options and the resources of what to do when you're in that risky situation. It's not to make you feel less than, it's to empower you. And so that's the difference that we need people to walk away with. We want you to feel empowered. We want you to feel educated. We don't want you to feel shamed. And we don't want you to feel like, something bad's going to happen to you just because you're trying to live your life.
Absolutely. I want to second that and say that, getting the vaccine or not wearing a mask, those are all behaviors that we adopt in order to protect our health. It's the same as taking PrEP or using a condom. We're assessing what our risk is for acquiring a virus that may have, long-term potential damage to our body. And then we're making our own personal choices about what our acceptable level of risk is, and then going for it. And that's what being a human is all about, is making your choices and living your life.
Absolutely, David. It is so funny to me how, we are exposing ourselves to potential harm day in and day out, but, we don't think twice about I buckle up every time I get in a car. I try and drive the speed limit. I try and drink in moderation. I don't smoke because I don't know how. So it's just funny how some of the things that we do every day to manage our exposure to harm, we don't even think twice about. But for some reason, this COVID thing has touched a lot of buttons for folks. So.
And I think, Leon, you said something that kind of triggered in my mind was, I think reasons why people are so triggered is we haven't had something like this in such a long time since the HIV epidemic came about, that we lost so many individuals. And I think when we're seeing the amount of people that we've lost since the beginning of this process, that scares the heck out of folks, and I think that's where that fear and that stigma is born. Well, stigma is fear. That's really all it is. It's just the ignorance of fear, and not understanding that it's through education that you're becoming liberated from those chains that bind us all. And so, like we're all saying here, have empathy. Think through things. Understand that people's perceptions are different. If you're in a space and you're in a store and somebody doesn't have a mask on, you have your mask on. Distance yourself. Follow the protocols that we're already being taught, that we've been taught since the beginning. And you don't need to put that person down because of that. Seeing these videos and people, fighting each other in stores because you don't have a mask on, or you do got a mask on, or whatever that case is, those are things that us as society need to move past. And it's through these moments that we're trying to educate folks to move past it.
All right, any other thoughts on this?
I just wanted to, first of all, I agree with everything Ari said. That was very well put. And just remembering that when we're in those situations where we see people who have made different choices than we are making, to understand that those people have different experiences, they have different circumstances, different, a different life than we have. And so we need to make space for them to live their truth and we live ours, and then just take the steps that we need to take care of ourselves and our family.
All right, everybody, thank you so much for your responses. That was our final question. Any final thoughts, any final comments before we conclude?
We can do this, Michigan. Yes, we can. Look what we did with the election. We can do this too.
I think we can. I agree with Leon. We're one tribe, and we got to do it together. Like that. That's what was that Black Eyed Peas song? We're one tribe, y'all.
Really, that's all it is. We can do this as long as we stick together, have faith, have some empathy, and at the end of the day, if there's anything that you can't help someone on, try to find the resources for it. We talked about the link before. If people need to get tested, at least know there are appointments at your local pharmacies like Rite Aid, CVS, Walgreens, that you can go get tested and you'll get those results back within 3 to 4 days. In that process of just making sure that you're protecting yourself and you're protecting your loved ones and the people that you care about.
And so before we end, I would like to ask our panelists to please give a shout out to your organizations and how they can be contacted.
Unified HIV Health and Beyond can be contacted through the internet, www.miunified.org, or you can give us a call. I know my Ypsilanti number by heart, 734-572-9355. Unfortunately, I don't know our Detroit number by heart, but that's because I'm old. But yeah, if you call the Ypsi office, we'll direct you and give you any and all the information we can.
If for access, the best way to find out about our vaccine clinics is to follow us on Instagram. You can call our Dearborn location, 313-216-2200, or Sterling Heights at 586-722-6036, or visit our website, www.accesscommunity.org.
And for the Detroit Public Health STD Clinic, you can reach us by our phone number, which is 313-577-9100. We're located at 50 East Canfield in Midtown. Regardless of your insurance, we take all walk-ins as possible. And we're a PrEP clinic and an MPEP site as well.
Thank you, everyone. We're going to conclude our presentation, our webinar. Thank you again, everybody. Can we move on to our final slide, please? All right, and so we want the conversation to keep going. We want the conversation to keep it moving. So this is just one of the sites that you can go to, greaterthancovid.org. People are continuing to have conversations like this around the country. So go ahead, check it out, see what people are saying. They have questions, they have resources. Just check it out, greaterthancovid.org. All right, and we wanted to also give information about the Michigan COVID vaccines. What was the site again, Ari?
So
Oh, here we go.
Here.
I'm bringing it up right now. All right. And so this is going to give you all the information that this is where we got a lot of our data for our statistics and stuff from here. Tell you about the vaccines, tell you about what the vaccine is, what they do. A great resource for folks. All right, so I first want to thank all of our panelists, David Ponzar, Ari Hampton, and Leon Golson for participating. I want to thank Evan Hall for facilitating and providing these lovely backgrounds for us. We truly, truly appreciate you. I want to thank any and everybody that participated in putting this event together. And anyone that watches this will be available on our MHAC Facebook page.
And let's not forget thanking the wonderful Alexis Hunter for hosting the whole discussion. You were
That's
amazing.
right.
Yes, I got you. Thank you.